Good morning. This is the OHSU Effect Inside Health and Science. We have a great show for you today, including how to keep kids comfortable at the dentist and how dark winter weather can affect our moods, even lead to depression. But first, we want to highlight a great partnership between OHSU and Columbia Memorial Hospital in Astoria. With me now on the OHSU Effect is Eric Thorson, the CEO of Columbia Memorial, and Dr. Mark O'Halloran, Professor of Medicine and Vice President for Strategic Outreach at OHSU. Good morning to you both.
Good morning.
Good morning, Lacey.
Tell me about this partnership. Columbia Memorial Hospital in Astoria is collaborating with OHSU to bring a really broader array of specialty care to the Astoria community. So what kinds of care are you able to provide because of this collaboration?
Our collaboration with OHSU began about 18 months ago with the concept to increase local access for cancer patients in our community. Prior to this work with OHSU, our local cancer patients would have to travel sometimes up to 2 hours to receive treatments for their, whether it's chemotherapy treatments or radiation treatments, leave the community when they're feeling at their worst. And we wanted to fix that. So we approached OHSU and developed a cancer program in our community that began in August of 2010, and it's been highly, highly successful. We're seeing the equivalent of a full-time practice in Astoria now, local treatment options available for all of our residents, and the best part, the access to some of the best cancer treatment that OHSU can provide in Portland through a very seamless model that's been created through this partnership.
Yeah, Mark, do you want to kind of explain how the model works?
Well, what we've tried to do is to expand OHSU's reach to really become hopefully relevant and an important partner in care that's delivered in local communities. And we've had just a wonderful partnership with the community of Astoria, and Eric has served as a community leader in healthcare issues and worked closely with the Mayor, Willis Van Duzen, and Dr. Sonny Park, and Bill Armington there, Dr. Bill Armington, as the whole community just really came together to help build a cancer effort there that included, for example, the Mayor identifying some urban renewal funds to help build out a cancer center there, the community college, Larry Galizio and his group and the art department helping with art for the cancer center, and the Community Foundation through the hospital, Columbia Memorial Hospital Foundation helping with funding infusion chairs and nurse navigators, and OHSU helping to provide the medical direction and on-site care, and also working with them to help train staff in the different aspects of cancer care to help build their program locally. And the whole goal is to try to expand what can be provided through partnership, because with the resources the way they are now in the state, we can't duplicate everything. We need to work as partners to try to expand what's available locally for communities. And so this has just been a wonderful experience for us. We at OHSU have learned a lot from people like Eric and Mayor Van Duzen to as far as how to help work to mobilize a community to accomplish something for the public health. So it's been a wonderful experience for us.
And I bet a big relief for the citizens of Astoria. You know, this is going to save them money. They don't have to drive as far. I mean, talk about those benefits as well.
Yeah, it's been tremendously successful in the community, and I think that it's, the drive is probably the biggest relief for these folks, but it's also really raised the confidence, I believe, that the community has in the local healthcare delivery system. You know, they have access to some of the best docs in the state through this partnership, and, you know, that's helped them have more confidence in some of the other services that Columbia Memorial offers independent of OHSU. So it's really strengthened the community, like Dr. O'Halloran was talking about, our city, our college, our local doctors all working together to provide the best care possible in a local environment. It's been fantastic.
Well, I want to talk about your telemedicine collaboration. What is that, first of all, and what does it mean for pediatric patients and stroke patients?
Well, I could probably start with that. So telemedicine is a term that's somewhat new to many people now, and if you imagine Skype, a kind of technology which is really an audio-visual call, and then change that to a high-definition signal that's encrypted over the internet for privacy and confidentiality, and it results really in a seamless care program where OHSU now has telemedicine sites at over 10 sites around the region. And so let's say, for example, a patient comes in to Columbia Memorial in Astoria and is having the early symptoms of a stroke. Well, a diagnostic study like a CAT scan could be done immediately, and the telestroke team, or the stroke team at OHSU, which has been in existence for over 20 years, is paged. Then the telemedicine unit is rolled into the room where the patient is in the emergency department, and the pager goes off, and let's say the stroke doctor could be off campus or could be at his daughter's volleyball game or something, and if the stroke pager goes off, he opens his laptop, logs on, and in about 20 seconds he's looking at that patient in Astoria, can pull up the CAT scan, review the image, and make a determination, for example, that this patient would be a candidate for an acute intervention. He then can activate life flight. The patient could be transported to OHSU. They land on the roof of OHSU Hospital, where a whole team is waiting in the cerebrovascular lab, where the patient can be immediately taken down. People are gowned and gloved and ready. Insert a catheter up into the brain where they can pull the clot out and arrest the stroke progress right in its tracks. And so this kind of coordinated care between our partners and really our academic medical center that serves the entire region is really what's needed for the future, so that we can better expand and leverage OHSU's reach across the state.
Well, Eric, I wanted to ask you about Dr. Diana Rinkovich. She's been a guest on our show, and she's the director of the Heart Disease in Women program at OHSU. But I understand she offers cardiology care at Columbia Memorial.
She does. That was our second program that we put together with OHSU in December of 2010. Diana Rinkovich started and opened our cardiology program, and she's fell in love with Astoria. She's become our full-time physician for our cardiology program. She's here 4 days a week. The 1 day a week she is in Portland. She's teaching or working with her colleagues there. But the community has embraced her here, and we have a booming cardiology program thanks to Dr. Rinkovich.
That's great. What other types of cardiology care are now offered at Columbia Memorial in conjunction with OHSU?
So a lot of diagnostic testing that we were unable to do without a full-time cardiologist here. So we've expanded into things like echocardiography, stress echo tests, nuclear medicine. She's beginning a pacemaker clinic, an anticoagulation clinic, and she's really helped our cardiac rehab program. We had that program going for folks that, again, had to leave town to get their interventional work done and then come back to town in our rehab program. But our rehab program has, tripled in volume with the help of Dr. Rinkovich.
Unfortunately, we only have about a minute left, but I wanted to just ask, are there any other collaborations in the works between OHSU and Columbia Memorial? Anything else we can expect?
Well, from an OHSU standpoint, we are now looking at how we can work with an innovative community like Astoria and other communities around the region to really work across OHSU's missions, including not only clinical care, but education and research. How do we help with education of workforce and bringing OHSU really into the community and helping them measure the care that they're delivering and partner in really a meaningful way across all of our missions of education, clinical care, and research.
Eric, what's on your radar?
More of the same. The rural communities are going to be challenged to find specialty care in the future. So, partnerships like this one, expanding into other specialists or specialties and subspecialty areas is really what's on the horizon. OHSU has been a fantastic partner for our community, and we have some other things in the works.
Eric Thorson, CEO of Columbia Memorial Hospital in Astoria, and Dr. Mark O'Halloran, Vice President for Strategic Outreach at OHSU. Thank you both for being here.